Welcome to another tutor short provided by the Educational Support Services Department of Lehigh Carbon Community College in Snexville, Pennsylvania, which is just outside of Allentown. These videos review key learnings for the science courses provided here at L-Tri-C. And please remember that the Educational Support Services Department does provide walk-in tutoring 5 days a week.
Hello and welcome to the Anatomy of Physiology 1 tutor short on the axial skeleton, given by your tutor Kim Rylander. In this video, we will be discussing the spinal column, each vertebrae, ribs, and the sternum as a part of the axial skeleton. The axial skeleton also comprises of the skull, so please watch our tutor short on the skull in our Anatomy and Physiology 1 playlist. In this photo, we can see the lateral and posterior side of the spinal column. This clearly indicates the types of vertebrae, starting with cervical, thoracic, lumbar, sacrum, and coccyx. Within the cervical vertebrae, there are 7 from C1 to C7. Within the thoracic vertebrae, there are 12, T1 through T12. Lumbar has 5 vertebrae, L1 to L5. Sacrum and coccyx are comprised of fused vertebrae. Within the sacrum, there are 5 fused vertebrae. Within the coccyx, there are 3 to 4 fused vertebrae. We can also notice the curvature of the spine. Cervical having a concave curvature, thoracic having convex, again lumbar concave, and sacrum and coccyx both making a convex curvature. Another way to remember the numbers of vertebrae within each category, remember the times you eat. You eat breakfast at 7 o'clock, cervical vertebrae. You eat lunch at 12 or noon for thoracic vertebrae. And then you eat dinner at 5 for lumbar vertebrae. Between each vertebrae are separated by pads of fibrocartilage called intervertebral discs. These will help cushion the vertebrae and absorb shock. We can also see these gaps between each vertebrae located here. This allows for spinal nerves to pass through from the spinal column. They are called intervertebral foramen. On this slide, we will focus on C1 and C2 of the cervical vertebrae. C1 is also known as atlas, and C2 is also known as axis. The function of the atlas is for us to move our head up and down like we're saying yes, while the axis helps us rotate our head left to right so we can say no. This is done when the dens articulates to the facet on the atlas. On the right, we have photographed the atlas and axis that we use here in the science lab. In the superior view of the atlas, we can see the superior articular facet located here. The occipital condyles located on the skull articulate to the superior articular facets of the atlas. Notice that there is no spinous process on this vertebrae. Instead, there is a posterior tubercle located here, as well as an anterior tubercle located here. Notice that there is no body on this vertebrae. Within the transverse process located here, we have transverse foramen located here and here on the inferior views. All cervical vertebrae have transverse foramen within their transverse processes. Looking in the inferior view of the atlas, here we have the inferior articular facet. We have the dens, the spinous process. Here we have the lamina, this section right here. And on the inferior view of the axis, we can see the body and the inferior articular facets. Here we can view a typical cervical vertebrae photograph from our science lab. Here we can notice the spinous process and how it is a bifid spinous process. We can notice the body, located both on the superior and inferior side. We can see the vertebral foramen, located here, where the spinal cord will fit through. On the superior side, we can see the superior articulate process and facet. The facet will be the flatter part, and the process is how it protrudes out. Again, we can see the transverse foramen, located here. Moving on to the thoracic vertebrae, we commonly see a face within the thoracic vertebrae. So we see a giraffe. When you look for this giraffe, this will help you orientate which is superior and which is inferior. With the nose of the giraffe pointing down or inferior, this is the correct way to look at it. So here we have the long and slender spinous process. We see the transverse process, the superior articular facet, the superior articulate process right here. We can see the body located here. We can see the inferior articulate process and facet located here. The inferior vertebral notch located here. We can also see the superior costal facet, where the head of the rib will articulate to, as well as the inferior costal facet. These are facets on the body of the thoracic vertebrae. On the transverse processes, we have the transverse costal facet, located here, where the tubercle of the rib will articulate to. And also we have the vertebral foramen located within here. Next, we have the lumbar vertebrae. A face that we can see is a moose. When you find the moose, this is how we know what is superior and inferior of the vertebrae. The spinous process of the moose is very big and blunt and comes outward posteriorly instead of slender and down inferior like in the thoracic vertebrae. So here we can see spinous process coming out and how big and blunt it is. We can also see the body as well. The inferior vertebral notch, inferior articulate process and facet. Here we can see the transverse process. Within here, the vertebral foramen. Here we have the superior articulate process, which are right here. And then on this side, we can see the facet right here. Moving on to the sacrum, from this portion up. And then below, we see the coccyx. Looking at the anterior view of the sacrum and coccyx, we can see the body of the first sacral vertebrae located here. We can see how all of them are fused and see the transverse ridges, which are the sites of the vertebral fusion located here. We also know the anterior sacral foramina located here. We also see the sacral promontory located here. At the bottom, or the inferior part of the sacrum, is called the apex, located right here. before starting the coccyx. We also see the wing-light ala, which forms by fusion of the transverse processes. They articulate laterally with the hip bones, which are located here. Moving on to the posterior side, we can see the auricular surface located here, which will articulate to the auricular surface on the hip bones. We can see the sacral canal would be located here, which will terminate near the coccyx by an enlarged opening called the sacral hiatus, which would be down here. We also have the facet of the superior articular processes located here. We also have the median sacral crest located here. And then lastly, we have the posterior sacral foramina located here. The sternum is composed of 3 fused bones. Here we can see the manubrium, then the body, and lastly, the xiphoid process. Within the manubrium, we can see the jugular notch located here, and the clavicle notch located here. Where the body meets the xiphoid process, it is called the xiphisternal joint, located here. Where the manubrium meets the sternum is called the sternal angle. Here we can see alongside the sternum the costal cartilages. Since there are 12 thoracic vertebrae, there are also 12 pairs of ribs, which form the walls of the thoracic cage. The first 7 pairs are called the true ribs, or the vertebrosternal ribs. This is because they attach directly to the sternum through their own costal cartilage. All of these attach directly to the sternum. The next 5 pairs are called false ribs because they attach indirectly to the sternum or do not attach at all. Pairs 8 and 10 are called the vertebral chondral ribs because they attach indirectly to the sternum through the costal ridge of 7, located here. And then lastly, we have the 2 last pairs, which are called floating ribs or vertebral ribs, because they have no sternal attachment. This is a picture of a rib taken in our science lab. We will now identify the structures of this rib. Here we have the head of the rib, followed by the neck, and then the tubercle of the rib, followed by the shaft of the rib, from here till there. Thank you for watching. To view any of the models or if you have any questions, please come to the Science Lab in SH 150 in the Educational Support Services Center. Thank you.